clinical correlation of cytomegalovirus infection with CMV-specific CD8 plus T-cell immune competence score and lymphocyte subsets in solid organ transplant recipients. By Messing, Atabor D., Abraham, Roshini S., Reasonable, Raymond R. via journals.lww.com web link. Introduction. Control of cytomegalovirus, CMV, infection after solid organ transplantation, SOT, requires a functional immune system. We assessed the association between quantitation and function of CMV-specific CD8 plus T cells and CMV infection in SOT recipients. Methods. During a 10-year period, selected kidney, heart, lung, pancreas, liver and composite tissue recipients were tested for CMV-specific CD8 plus T cells immune competence, CMV CD8 plus, as measured by enumeration, interferon gamma production and CD107A/B degranulation. Quantitative and functional data were used to assemble T-cell immune competence, TIC, score. CMV infection was diagnosed by PCR in blood and other samples, or histopathology. Results of 130 patients tested, 59 had CMV infection or disease. The median onset to CMV infection was 10.5 months, IQR 5.518.7. Gastrointestinal disease, 28.8%, pneumonia, 20.3%, and CMV syndrome, 17%, were most common presentation. An impaired nonspecific or CMV CD8 plus TIC score was associated with tissue invasive disease, HR 2.84, 95% SIR 1.0311.81, P equals .04. Patients with impaired CMV CD8 plus TIC score had longer viremia duration, 42.4 versus 18.8 days. P.001. Patients with impaired nonspecific or CMV CD8 TIC score had higher risk of relapse versus our CP equals 0.03. CMV infection disease lower median absolute lymphocyte count cells and CD4 T cell conclusion. CMV specific CD8 function correlated the course after SOT. Measuring these has potential to assist in its clinical management. Correspondence, Roshini S. Abraham Ph.D. Department Laboratory Medicine Pathology Mayo Clinic Rochester M.N. Abraham. Rochini Raymond R. Reasonable M.D. Division Infectious Diseases Reasonable. Raymond Authorship Page 8 Tabor D. Messing, Participation Performance Research Data Collection Analysis Writing Manuscript Abraham, Reviewing Reasonable, Design Approving Disclosures, None Funding, Copyright Walters Kluwer Health Incorporated All rights reserved. Add tags, currently, Allergy and Immunology, #Medicine by Alexandros Sfakianakis, #O.R.L. Sfakianakis, #E.N.T, #Ola by Sfakianakis G. Alexandros.